Okay, my name is Marian and I'm going to be performing a head-to-toe examination on Janice. Hi Janice.
Hi.
How are you?
I'm good, thanks.
Good. So today I'm going to be performing a head-to-toe assessment on you.
Okay.
We're going to go through each system and I'll walk you through each one, okay?
Okay.
So I'm observing Janice right now and her general posture, she's sitting upright. She has good facial expressions, skin color is intact, good demeanor. I'm assessing her level of conscious and she responds to all my instructions. She has good hygiene, no abnormal odors. She looks well dressed. Her vital signs were taken. Her height is 5'7". She's 135 pounds. Her temperature was 36.5 Celsius, 120/80 for blood pressure, 62 pulse, and 19 respiration, all within normal limits for her age and Janice, I'm going to ask you a few questions. So do you know what you're doing here today?
Yeah, I'm receiving a head-to-toe physical exam.
Okay, and where are we?
I am actually at my house in San Francisco.
And do you know the date and time?
It is May 6th today, and the time is about 2:15 in the afternoon.
Okay, great. So I have 3 words for you that I'll have you repeat after me, and then also I'm going to ask them of you in a few minutes, okay?
Okay.
So the 3 words are cat, house, and pencil.
Cat, house, and pencil.
Okay. Can you tell me what this object is?
That is a pen.
Okay, and the color?
It is green.
Okay, and what color is at the top?
Silver.
Okay, and can you repeat the 3 words that we just talked about?
Cat, house, and pencil.
Great. Okay, good. So now I'm going to assess your skin, hair, and your nails.
Okay.
Your skin is moist mucous membranes. The patient the patient appears to be close to her age. The texture and quantity, she has a full set of hair. No patches or any balding on any side. Her nail color and shape is pink. She has good hygiene. No rashes, scars, or discoloration on her arms or her hands. And I'm just going to see your scalp. Hair is full. There's no lesions on her scalp. And now I'm going to check your head and face, okay?
Okay.
So as I'm looking at Janice's face, her face is symmetrical. She has no drooping on either side. I'm going to have you tell me how a sharp and dull sensation, okay?
Okay.
So when you feel sharp, tell me sharp. If you feel dull, tell me dull.
Okay. Sharp. Dull.
Okay.
Sharp. Dull. Sharp. Dull.
Great. Okay, and then I'm going to have you frown for me. Good. And can you raise your eyebrows and a grimace? And puff your cheeks. All that I told you I've done is symmetrical on both right and left side. Now I'm going to test your sternomastoid muscle.
Okay.
So all you have to do is press against my hand.
Okay.
Pressure against my hand. Perfect. Good. You can pressure on both sides.
Okay.
Now I'm going to palpate your lymph nodes and make sure that they are, or assess both sides. Okay. They don't feel swollen. Everything is symmetrical. Now I'm going to look at your eyes. Your eyelids are symmetrical. There's no discharge present. Your sclera is white. Conjunctiva has no discharge. There's no periorbital edema. And now can you just read for me the first sentence here, or the first line?
Head-to-toe examination of adults.
Perfect. Now I'm going to check how your pupils react to light. I'm going to flash a flashlight into both sides, okay?
Okay.
So Janice's eyes are round, reacted to light, and they accommodate to light. How they accommodate is they constrict while the light was in her eye, and they dilated when it was dark. Now I'm going to check your cardinal gazes, okay? Just follow my finger. And then just follow. Perfect. Okay. So now I'm going to check your ears. There are no abnormalities on both ears. Both ears are pierced with earrings. Everything looks clean and intact. Now I'm going to test your hearing, okay?
Okay.
This is called a tuning fork, and it's going to be the Weber test. And I just want you to tell me if you hear it equally on both sides or more on the right or left side, okay?
Okay. I hear it, and I hear it equally on both sides.
Perfect. Okay, now I'm going to inspect your mouth. Do you mind just opening your mouth for me? Okay, as I inspect your mouth, her tonsils are in the right size, not swollen. There's no foul odor. There's no redness on the tonsils. Can you clench your teeth for me? Okay, and I'm just going to check your temporal and masseter muscles. So it's just right here. And then here's any pain on your temporal or masseter muscles.
No.
Can you open your mouth for me? She's able to open wide and close without pain.
Mm-hmm.
Okay. Now I'm going to assess. Well, I've been assessing her voice during the exam. She is able to talk without any trouble. She has also swallowed when I assessed her mouth. Can you actually just open your mouth one more time and say "ah" for me? And stick your tongue out and move it right to left. Perfect. And then now I'm going to inspect your neck. Okay, and I'm going to make sure that your trachea is in the midline.
Okay.
So I'm just going to feel right here. Trachea is midline and smooth. And then I'm going to palpate your lymph nodes again, which they were fine earlier. All symmetrical on both sides. Now I'm going to palpate your carotid artery. And can you shrug your shoulders for me? Perfect. Okay, and she's able to shrug shoulders symmetrical on both sides. Now I'm just going to assess your chest wall. Okay, your shape looks fine. She's sitting upright with no difficulty in breathing or sitting in this position. And now I'm just going to listen to your lungs. Okay.
Okay.
Janice's desired posture. She's not leaning forward, nor is she having a hard time in the position she's at. She's not using any accessory muscles of neck for her breathing. I don't see any use of intercostal muscles or respiratory stridor. And then before I listen, I don't hear anything of that as well. So now I'm just going to listen to your front of your chest and the back of your chest. I'm going to use my stethoscope. I'll just have you breathe. Take deep breaths each time you feel the stethoscope, okay?
Okay.
Okay, and now I'm going to go to the back. Okay, Janice is able to take nice deep breaths. They're symmetrical on the anterior and posterior. Now I'm going to listen to your heart and also inspect and auscultate as well, okay?
Okay.
So I'm going to palpate your PMI. It's at the 5th intercostal space midclavicular, just right here. And I'm going to palpate the right chest wall for any thrills, and I don't feel any thrills or hear any thrills. And then I'm going to palpate your carotid artery again, but this time I'm going to listen to your heart as well as feel for the carotid artery, okay?
Okay.
Okay. And I can feel her carotid pulse as well as while I'm listening to her heart. Now I'm going to auscultate in your heart area, okay?
Okay.
So I'm in the aortic at the 2nd right intercostal space, the pulmonic at the left intercostal space, the tricuspid at the 4th or 5th intercostal space along the sternal border, and the mitral at the 4th or 5th intercostal space midclavicular line. And there are no abnormal sounds or murmurs noted. Okay, now if you don't mind laying down, I'm just going to assess your abdominal.
Okay.
Okay, if you don't mind pulling your tank top, yes, perfect. So now I'm just inspecting her abdomen. There is no distension or scars. I'm going to also auscultate in all 4 quadrants to make sure that your bowel sounds are present. Okay, bowel sounds are present in all 4 quadrants. And then I'm just going to palpate your liver edge, just right here. And I'm also going to palpate in all 4 quadrants lightly and then deeply, okay? Do you feel any pain while I'm doing this?
No.
And I'm going to palpate a little bit deeper. Any pain there?
No.
Okay, now I'm going to check to see if you have any pain. So I'm just going to press down, and when it releases, let me know if there's pain.
No.
No. Okay. Okay, now I'm going to check your ankles and your feet. There is no edema present on Janice's feet. There's no discoloration or varicose veins. There's no edema. I'm going to palpate your dorsalis pedis on both. And both are bilateral 2+. Then I'm going to check your radial pulse. Bilateral 2+ as well, which is all normal. Now I'm just going to observe you walking, okay? Can you actually first, before you walk, just grab both my hands.
Okay.
Or you squeeze my hands.
Okay, thank you. Okay.
Okay, it's bilateral grip, and normal for her to be able to grip my hands. Now I'm just going to assess your walking, so if you could walk across the room for me. Okay, hands, knees are all, accessory muscles are normal. I'm going to observe you for scoliosis, so do you mind turning around and then bending forward? Okay, I don't see any curvature. Everything is aligned from top to bottom of the spine. And go ahead, stand up. Okay, and lastly, if you, she could bend forward also. This way, perfect. Bend forward. Yep, thank you. Okay, and now I'm just going to be checking your you for your pronator drift. Okay, so go ahead and take a seat. And put your arms out for me and close your eyes. Okay, and I see that she is not drifting on either side. And lastly, I'm just going to do your deep tendon reflexes, okay?
Okay.
So go ahead and relax your arm for me, just right there, perfect. Okay. Perfect. Then I'm going to do your knee. Yep, perfect. And if you do the left side. Perfect. Okay. And I'm going to do your ankle, okay? Perfect. Perfect. And if you could just lay one more time, I'm just going to check for one more. It was just your Babinski.
Yeah.
Okay.
Okay.
All right, that concludes my assessment. Thank you, Janice.
You're welcome.